Well, a very warm welcome to everyone who has joined us for this month's BSL Talks, which is focused on tackling poverty in the early years. My name is Trav McLeod. I'm the Executive Director of the Brotherhood of St Laurence, and we're delighted to be hosting this conversation at such an important time of reform in the early years. Before we begin, I'd like to acknowledge the traditional owners of the land. For me, that's the Wurundjeri people of the Kulin Nation. I'd like to acknowledge the traditional custodians of the various lands we're all zooming in from today, and pay our collective respects to elders past and present. I want to extend that respect to Aboriginal and Torres Strait Islander people who are joining us today in what is such an important year of recognition for the First Peoples of Australia and to elevating their voices. Just a few matters before we start. I'd like to introduce our Auslan interpreter, Sarah. Thank you for being with us today, Sarah. Unfortunately, there was no caption available today, but rest assured, when the recording of this conversation is made available, it will be captioned before it is released. If you would like to tweet and use social media during the discussion, which is sure to be lively, please use the hashtag BSL Talks. And lastly, and probably most importantly, you're very welcome to pose a question to the panel during this session. And so if you'd like to do so, please submit a question via the Q&A button. So let's begin. We all know early childhood is the launchpad for life, for children, for families, and for the country. A brilliant early childhood development system can have an enormously positive impact on inclusion, on equity, on outcomes, and in preventing and alleviating poverty. Unfortunately, the early childhood system we have in Australia today, to the extent you could call it a system, is not fulfilling its potential. The system is inaccessible, it's outdated, it's fragmented, and unaffordable for the families who need it most, despite a number of important reforms, particularly over the last decade. Many Australian children are still missing out on early childhood education and care altogether. The good news is that there is now collective recognition of this across the country. Early childhood has become very much Highway 1 on the national reform agenda. In February, I was fortunate enough to lend BSL's voice to the federal government's Early Years Summit, which will inform the National Early Years Strategy, which, if done right, will completely reshape how we approach early childhood development in Australia. And it was at the summit that Social Services Minister Amanda Rishworth said that in 2021, for the first time since 2009, around 45% of Australia's children were experiencing higher rates of developmental vulnerability in at least one area. And with nearly 1 in every 2 Australian children developmentally vulnerable, it's little surprise, and you saw this when you joined the seminar, that Australia is ranked 32nd out of 38 on a list of wealthy country rankings for childhood wellbeing. The early years must be a national reform priority because a better early childhood system is the gateway for expanding children's rights, for addressing disadvantage, and to growing Australia's future prosperity. And that requires a major shift in how we think about the early years and about supporting children. More than adopting a rights-based approach, it's centering young children in public policy and doing things with them because they matter and because their outcomes in their early years will shape the future of our community. Everybody benefits from this approach. There is no disadvantage to helping all children to start better and to make Australia a much better place to be a child and to raise a child. Now, to talk about the importance of the early years and how critical they are to preventing and alleviating poverty, we are very fortunate to be joined by three people who are helping to shape the reform agenda in very positive ways. And such is the quality of the panel, we've had enormous interest in today's discussion. And so I'll just say a little bit about each of the panellists before posing some questions to get the conversation started. So our first panellist is Jay Weatherall. Jay served as the 45th Premier of South Australia and is the South Australian Labor Party's longest continuing serving Minister of the Crown. He was elected to Parliament in 2002, served 16 years in a diverse range of portfolios, including Treasury, State Development, Education and the Environment. He holds law and economics degrees from the University of Adelaide. Jay is industry professor at the University of South Australia and an ambassador for the International Children's Education Organisation, Reggio Emilia. As many of you know, Jay is the director of Thrive by Five for the Minderoo Foundation. And BSL is a proud member of the Thrive by Five network. And I've seen in recent years at BSL and in my former role at the Centre for Policy Development, just how hard Jay has worked to put children on the national reform agenda. So welcome, Jay. Our next panellist is Professor Deborah Brennan, AM, who was appointed an Associate Commissioner with the Productivity Commission earlier this year to work on the Early Childhood Education and Care Inquiry, which I'm sure we'll hear a little bit more about during this discussion. Deb is one of Australia's leading researchers in comparative welfare, family policy, gender and politics, and on early childhood. She is Professor Emeritus at the Social Policy Research Centre at the University of New South Wales and has held visiting positions at the London School of Economics, the University of Oxford and Trinity College, Dublin. I think we were all delighted when Professor Brennan was appointed to the Productivity Commission to co-lead the inquiry. So welcome, Deb. And our third panellist is Gretchen Young. Gretchen is an Eora descendant from Redfern in New South Wales. Prior to relocating to Melbourne, Gretchen lived in northern New South Wales on Bundjalung country for many years. Gretchen has worked in primary and community health settings and worked for some time in the NGO sector in northern New South Wales, leading a large community-based organisation. Gretchen was the executive officer of a sector development organisation in Waterloo in New South Wales with a focus on Aboriginal social housing tenants. Gretchen has held leadership roles providing input and advocacy within the New South Wales State Government and in relation to early intervention and prevention programs, community development and place-based approaches to community challenges. And Gretchen is currently the National Program Manager at SNAKE, the National Voice for Aboriginal and Torres Strait Islander Children, which is doing a power of work on these issues at the moment. And BSL is very proud to be an associate member of SNAKE. So a very warm welcome to all of you and to our panel. I'm going to start with you, Jay. Why are the early years on the national agenda now? And what are the biggest issues from your perspective?
Thanks, Trav, and thanks for putting this on. Brotherhood of St Laurence have obviously been a leader in tackling questions of social disadvantage, and so many of us, the reason we actually do what we do is to grapple with these questions. So thank you for the leadership role. And it's great to be on this panel with both Deb and Gretchen, a real privilege. And I should also say I'm coming to you from the land of the Whadjuk people here on the Noongar Nation in East Freo. Well, the reason the early years are on the national political agenda is because of all of you, all of the people in this room and across the nation who have raised their voices to put it there, and not just in the last couple of years, but really over decades. So this doesn't spring out of nowhere. It actually comes from decades of people talking about essentially early childhood and its critical importance. And the reason why that's managed to capture the political agenda is because we've come together in a campaign where many voices are actually promoting one message, rather than breaking up into our various little subgroups into infant maternal health or disability services or childcare or preschool, or which are all important and they all comprise the early years. But we've come together in a single campaign to actually promote a single message, and that becomes powerful. And when you have a powerful cut-through message, you start to grab the attention of the political process. I suppose something else has also happened, and that's the objective circumstances have also assisted us, in the sense that the COVID's really smashed the service systems that relate to the early years. And it's interesting, there are some service systems that survived really well during COVID, and there are others that really almost collapsed. And that's part of the problem as well. When you have a resilient system like, say, the healthcare system that largely stood up, or the school-based education system that largely stood up, and then you see the earlier system that almost fell over, and they had to recalibrate it and almost turn that system off and create a new system. It sort of tells you the weaknesses that exist, and that's a powerful lesson about what we have or don't have in the early years. So what have we gone about this? Well, we've campaigned purposefully about, as I said, a single message. We want a universal, high quality early childhood development system for this country. And that's been the single most important element, if you like, of why we've been able to put this on the national political agenda. So in terms of the challenges about, what sort of stands in our way of realising this objective of creating a new high quality, universally accessible, integrated system, I think it's the age-old problem of getting lots of different agencies and lots of different levels of government to work together in a single coherent service system. And CPD's done a power of work on that, Centre for Policy Development, in thinking that through. But I think to actually advance that agenda, we're going to need to ask ourselves, what does a high quality system look like? What does it have? And I think what it needs is legislation. It's hard when you look at all the big systems like Medicare and NDIS, they need legislation. They need Commonwealth state arrangements and cooperation. And they need, I think, a vehicle to drive forward this agenda, something that can actually, somebody that holds the vision for children. Because even though we do talk about these service systems, about what we want to see in all of these various subsets, if you like, of the early childhood system, in the end, it's actually also about culture and about what our vision is of the child, how we look at little children and how central they are in our society. There's got to be some place somewhere where somebody is accountable and is looking at children from birth to 5, at least, some say birth to 8, but whatever the right definition is of early childhood, somebody needs to be the holder of that, and they need to be accountable for that.
Thank you, Jay. We'll come back to that idea of a legislated entitlement or guarantee in a moment. But you did talk about how COVID revealed how essential, but also how fragile the early childhood system is. And Gretchen, I thought I'd ask you at this point, in your experience, and despite the very best efforts of many organisations, including SNAKE, there are still children that aren't engaged in early childhood programs. Can you talk a little bit about the barriers children are facing that's preventing them from participating in the current early childhood system?
Yeah, thanks, Trav. And thank you for inviting me to speak with you today. I'm very pleased to be here with colleagues and to talk about some of the exciting work that SNAKE is doing. I'd just like to acknowledge and show my respect to the Wurundjeri people, who are the traditional owners of the land where I am today, here in Naarm, and pay respect to their elders past and present, and any Aboriginal or Torres Strait Islander brothers or sisters on the line today. So in terms of barriers, I guess I'd start off by stating that exclusion and discrimination have led to a disproportionate number of Aboriginal and Torres Strait Islander families living below the poverty line, creating barriers to accessing early childhood services such as childcare and early learning. So SNAIC has worked for over 42 years to reduce economic and social disparity. The National Agreement on Closing the Gap that puts Aboriginal and Torres Strait Islander people in the driver's seat is helping to drive change. We know that increasing a child's opportunities in their early years is foundational to improving outcomes across the span of their life. And we know that we have a critical window for our children from conception to age around 5, where the health, learning, development and identity of children can be positively influenced more than any other time in life. What a time to be alive, right? So for Aboriginal and Torres Strait Islander children, we must interrupt and heal the intergenerational trauma that impacts upon communities and limits development and life opportunities for our children in their early years. So the effects of historic policies of exclusion and discrimination lead directly to those barriers of Aboriginal and Torres Strait Islander people experience when accessing services, including those in the early years. In late 2021, SNAIC released the National Aboriginal and Torres Strait Islander Early Years Strategy that was commissioned by the federal government at that time. And yes, it is a bit Groundhog Day that we're again being asked to contribute to an early years strategy, but that's government. And as Jay and Deb would know better than me. So SNAIC undertook community consultations that informed that strategy, and that development told us that participation in early childhood education and care for children 0 to 5 is at 2/3 the rate of non-Indigenous children due to a range of barriers. Some of the barriers identified by those community members in community consultations included affordability, service quality, cultural competency in services, transport barriers and geographical location. And of course, affordability is a huge factor, and I'm sure that other panellists will raise that. But in many community consultations, cost was identified as a major barrier to families' interest and potential take-up in early childhood services. As an example, the median weekly household income in Number Mall is $642 per week, below the Northern Territory poverty line of $842 per week per household. Startling figures. This affordability barrier, or poverty barrier, if you like, not only prevents access to childcare, it says to government decision makers that families won't be able to afford childcare or learning, so they don't build the centres. It's a ridiculous catch-22 situation. So the answers to breaking down these barriers lie in the strength of our Aboriginal and Torres Strait Islander culture and communities. Aboriginal and Torres Strait Islander community-controlled early years services are uniquely placed to break down those barriers, to access and deliver culturally safe, holistic supports to Aboriginal and Torres Strait Islander families. In terms of those services, they're also uniquely positioned to provide vital integrated child development and family supports beyond mainstream childcare and early learning programs. Those kinds of additional supports include fostering connections to language and culture as they're trusted by families in the communities in which they operate. So they are truly place-based and embody Aboriginal people's right to self-determination, because they're accountable entirely to and governed by local Aboriginal and Torres Strait Islander communities that they serve. So Aboriginal and Torres Strait Islander communities and families have the answers and have over 60,000 years of child rearing experience. I think they know what they're doing. Thanks, Trav.
Thank you, Gretchen. And I'm conscious the Economic Inclusion Advisory Committee, which recently reported, spoke about the strength of those approaches and that 65,000 years worth of experience in raising children and nurturing country. So thank you for sharing that with us. Professor Brennan, I'll come to you. So you've got a history of working in this area in a really rigorous and powerful way, and you're now co-leading the Productivity Commission inquiry into Australia's early childhood education and care system. What's front of mind for you now that the inquiry is underway, and what does success look like from your perspective? You got it. While you're doing that, Yasmin, thank you for being one of our Auslan interpreters today. Thank you very much. Over to you, Deb.
Thank you very much, Trav, and thank you for the opportunity to participate in the panel. I've had a lot of dealings with the Brotherhood of St Laurence over the years and greatly respect the organisation. And likewise, my panellists, I'm really honoured to be part of this group. I'm speaking to you from Gadigal country here in Sydney, and I too pay my respects to the elders of that community, past, present and emerging. Well, front of mind for me at the moment is the incredible opportunity presented, really a once in a generation opportunity presented by the government requesting the Productivity Commission to conduct this very wide-ranging inquiry into early childhood education and care. I'm really thrilled to be part of it, but I'm also very aware of some of the challenges which I'll come to. But I'd just firstly like to say a little bit about the terms of reference that the Productivity Commission has been, that have been given to the Productivity Commission by the government. And I urge anyone who's not yet had a chance to look at them to do so if they're interested. They're on the Productivity Commission website, and there it goes. And they are extremely wide-ranging. So what the government has asked the Commission to do is to develop a plan for universal, affordable, quality early childhood education and care that supports children's learning and development and reduces barriers to workforce participation. It's asked the Commission to pay special attention to families and children who are experiencing disadvantage and vulnerability of various types. And of course, that means a particular focus on First Nations children who are particularly poorly served by current arrangements. It also, of course, means a wider group of children and families living in poverty. And we all saw the statistics, or many of us saw the statistics that rolled through at the beginning of the seminar, illustrating quite shockingly how deep and entrenched poverty has become in Australia. Of course, we will also have a focus on children and families living with disability, on recently arrived children and families, children living in remote areas. So we really have been asked to foreground those particular groups, while at the same time coming up with a plan for a system of early childhood education and care that really neatly balances the interests of children and of their parents and wider communities. So really exciting terms of reference. There are some other things I might come back to about it later on, but they're really the central points. So I think we began the inquiry 2 months ago on the 1st of March, and the Productivity Commission process is to begin by talking with people and finding out about people's response to the terms of reference, what particular organisations, providers, other groups are expecting from us. And that's been a really fascinating process so far. We're only a little way through it. But having been engaged in those conversations, not only over the last 2 months, but over a long period, I'm also really aware of how big the task is, what a complex challenge it is. Early childhood education care really is a complex sector, and our starting point is a tough one. I won't rehearse those statistics about children's vulnerability, because I think they are familiar to many people in the audience here, but they are really it is really quite disturbing to think what a steep gradient we have in the condition, in what children bring with them when they arrive at school. Some children have had wonderfully rich opportunities. Other children have lived in circumstances of extreme deprivation and have not been afforded the opportunities of their peers. And starting school at such unequal starting point really sets those children off in for a poor trajectory. Of course, there's a lot that schools can do, but early childhood lays the foundation. There's no doubt about that. So another part of our context is that Australia is lagging well behind many other similar countries in the extent to which we invest in early childhood education and care, and in related provisions such as paid parental leave. And although we have one of the most highly educated female workforces in the world, we're ranked really low, number 70, in terms of women's economic participation. So we also, part of our challenge is that our starting point is a system that has historically been quite divided between education and care, and thinking through ways of working through that divide and the challenges that brings in terms of workforce in particular, but other issues to do particularly with the complexities around funding and eligibility, means that we are presented with a really big challenge, big and exciting, but very big challenge.
Thank you, Deb. And we might share later on some of the previous work that you've been involved in. I know one of the big reports was for the Council of Australian Governments that Jay is all too familiar with. And Jay, I might come back to you because Deb's spoken about the opportunity, and you mentioned that as well. And you talked about the idea of an early childhood guarantee or legislated entitlement. And it would be terrific if you can say a little bit about what would be in that entitlement and what it would take to put it in place so that the new strategy, early years strategy, can really be a game changer for kids and for the country.
Yeah, thanks, Trav. I suppose at the level of people's lives, it's, a pram walk away in every suburb, there'll be a place that's welcoming to parents even before they have a child, be a source of information and support, and all of their needs will be met, whether it's their workforce needs in terms of them going off to work, whether it's them just wanting to participate in the broader community, whether it's parenting advice, whether it's the challenges that some children might have that have special needs, or just the support that comes from actually being with other parents and those community connections that allows people to sustain you in those first 5 years. I mean, it's a really tough time when you have kids, and it can be a very isolating time. If you're living, on the edge of the urban area, no great public transport, you might not have your car, you may or may not have a partner, you can be, your family may not live near you. It can be a really tough time. So if you can build something that exists at the level of the neighbourhood, that's, I think, the gold standard. Now, what that means, and governments love breaking things up into bits and pieces. Well, how that manifests itself, of course, is programs and services. And we do need to think through those things, because even in a perfect world, I don't think we're going to abolish the distinction between Commonwealth and states and health and education and child protection, etc. I think what we can hope for is that they work better together, and that what people experience when they go into one of these places is just a trusted person, and that all that back room is dealt with by someone else. All they get is what they need, and their children get what they need. So that does mean, I think, a legislative guarantee around paid parental leave. It's a legislative guarantee around infant maternal health checks. It's a legislated guarantee around a certain amount of childcare, what we currently call childcare, early childhood education and care, a certain amount of preschool. Some jurisdictions have 2 years of preschool or moving towards it. And also a navigation, the ability, somebody that actually brings all these things together. And, you know, sometimes we've said that what a great system looks like is a number of characteristics. Quality, so it's got to be high quality, which takes you back to the workforce and how they're supported and valued. It's got to be universal, every child, not just some children. The great irony with our current system is that the children that would most benefit from childcare are the ones that aren't using it. So we need to remedy that. We need to have essentially service integration, all these things in one place. Fourthly, we need, I think there has to be place-based. It has to be respond to and led by the communities, particularly important in Aboriginal communities. And fifthly, someone has to be responsible. There has to be an agency that you can point to. The moment there are a plethora of agencies where early childhood is something that they do, but it's not the main thing they do. So it's not the main thing education does. It's not the main thing health does. It's not the main thing child protection does. So it can't be a subordinate part of everyone's role. Somebody's got to be responsible. So we think that's what a great system looks like. And somehow we've got to have a piece of legislation and a vehicle to drive that.
Terrific. Thanks, Jay. We might get some reactions on that description of that trusted system, a pram walk away, in the discussion in a moment. But Gretchen, I mean, Jay did talk about the importance of investment in place. What investment, in your view, needs to be provided to ensure children are connected to family and to place?
Yeah, thanks, Trav. And I think picking up on some of Jay's themes around that responses must span all fields. It can't be a siloed approach. That those approaches need to include maternal and child health, housing, early education and care, disability, family and parenting supports, ensuring child and family safety, and ultimately our aim is about promoting cultural identity and development. So Aboriginal and Torres Strait Islander community-controlled organisations have a vital role to play across all of these areas, and collectively it'd be great if we could work to build their role in supporting young children and their families. Aboriginal community-controlled organisations, and once again I will get a little stuck on a theme, but they are embedded in culture. The significance of strong connection to culture on the development of a strong sense of identity and resilience amongst Aboriginal and Torres Strait Islander children is supported by an extensive body of evidence. The evidence also shows that connection to culture improves the effectiveness of programs for Aboriginal and Torres Strait Islander parents and caregivers and improved early childhood development outcomes. Moreover, early learning programs that don't reflect the culture and knowledge of local Aboriginal communities are not seen as culturally safe and tend not to be used by families in that community. Despite this, there's currently no explicit requirement to embed culture in mainstream ECEC services, raising critical questions regarding the cultural safety and inclusivity of mainstream ECE services for Aboriginal Torres Strait Islander children and families. This is problematic, as you can imagine, because early learning programs that don't reflect the culture and knowledge of the local Aboriginal or Torres Strait Islander community are not seen as culturally safe. And once again, parents will not access those centres if they're not seen to be culturally safe. So achieving the ambitious national agreement on closing the gap target to see 55% of Aboriginal and Torres Strait Islander children on track against the 5 domains of the AEDC by 2031 will require a coordinated whole of government and whole of community response to children's needs that Jay's already outlined. So outcome 4 in the Closing the Gap agreement is that Aboriginal and Torres Strait Islander children thrive in their early years. Work under this outcome includes developing options to measure and report on the proportion of Aboriginal and Torres Strait Islander children living in poverty. And we within SNAIC continue to work and press all levels of government to achieve this, using every lever that we have. So what do some of these levers look like that we can choose or look at to break down the barriers and lead to better outcomes for children? We must encourage the re-examination of policies that have historically been viewed as inconsequential to early childhood development, housing, environmental, transportation policies, and be committed to a joined-up approach to improving early childhood outcomes. We must take a social determinants approach that addresses the full spectrum of social, political and environmental determinants of Aboriginal and Torres Strait Islander wellbeing. So this means that traditional social determinants, including housing, employment, education and neighbourhood quality, must all be addressed concurrently, not separately. There's also an urgent need to address the unique social determinants of Aboriginal and Torres Strait Islander wellbeing, including the persistent experience of racism among Aboriginal and Torres Strait Islander peoples, including mothers accessing mainstream perinatal services and care. We must strengthen the Aboriginal community-controlled sector, particularly early childhood services. They are holistic, integrated and responsive models of care that integrates significant community participation, including employment of local Aboriginal community members. Our early childhood services are based on an integrated service delivery model, often regarded by community as one-stop shops, hubs, or in general offer wraparound services and supports to families as they need. They're place-based, they're governed by local communities. They are embedded in culture and Aboriginal and Torres Strait Islander ways of doing and being. So local Aboriginal staffing of services is essential to their capacity to provide culturally safe care. It's also important that efforts focus on developing and funding strategies that enable the employment, training and retention of local Aboriginal and Torres Strait Islander people. Bit of a no-brainer, but not only does investing in a local Aboriginal and Torres Strait Islander workforce minimise the need to provide housing and other incentives, particularly in quite remote areas, to entice an external workforce to the region, it also facilitates the employment of local Aboriginal and Torres Strait Islander staff who have a commitment to and a connection with their local community, and ultimately supports communities to be lifted out of poverty. So one way that SNAIC, and I'll get onto the Connected Beginnings bandwagon, but one way that SNAIC is working to support these approaches is through our role as community partner in the Connected Beginnings program. Connected Beginnings is an Australian government program that draws on the unique strength, knowledge and expertise of local Aboriginal and Torres Strait Islander communities to address the community-specific needs. Connected Beginnings is also community owned and led, which means that Aboriginal and Torres Strait Islander people decide on how activities funded by the grant are delivered to their people in their own places and on their own country. So in doing so, Connected Beginnings recognises the trust and collective expertise that ACOs have in their own communities, and it strengthens and supports those services so that we can close the gap for children and families. One of the defining features of the program, and it's quite unique, is that there's a presence of both an education-funded backbone organisation and a health-funded organisation at each site. Education-funded organisations that include child and family centres, Aboriginal health services or early childhood education services provide leadership and strengthen the integration of services. A recent evaluation of Connected Beginnings sites indicated that an increase in centre-based daycare enrolment, an increase in the attendance of centre-based daycare, and an increase in the year before full-time schooling preschool enrolment and transition to school programs. So this is an example of where SNAIC works as the Connected Beginnings community partner, providing support to sites to develop, lead and showcase expertise and knowledge. So finally, Trav, and I'm sorry if I've gone over time, but SNAIC has embraced for over 4 decades the amplification of voices of Aboriginal and Torres Strait Islander children and families. So a voice that's enshrined in the Constitution will fire the ambitions of all governments, services and leaders to work with us, breaking down barriers that lead to exclusion and poverty. Thanks.
Here, well said, Gretchen. Thank you. So I'm going to start picking up on some comments and questions in the chat and by the Q&A. Now, Deb, one that's come up is around the focus on workforce participation. And of course, there are multiple objectives to early learning and early childhood education and care. One, of course, is to support early childhood development and learning and outcomes, the ability of children to live a thriving life. Another is to enable parents to participate in the workforce. How, in your view, are those objectives reconciled or better reconciled?
Thanks, Trav. Well, first of all, I acknowledge the comment made in the chat, and I think it's a really important one. And one of the reasons I have been so encouraged by the terms of reference for this inquiry is the way that the terms of reference firstly mention children's learning and development first and workforce participation second. But really, I don't think I think what they're trying to do is in the terms of reference is to say a good early childhood education and care system is going to support both of those objectives. And I've always thought over the long period that I've been involved in this sector that there isn't really, I don't see the two objectives as being in conflict in principle. I think that the problem is that in Australia, historically, we've developed two separate systems. We developed in the 19th century a system that was focused on providing what was called childcare for parents, originally for single mothers, not to be too precious about it, for single mothers, now for working parents. And we separated that from a different stream of services that were funded by state governments rather than the Commonwealth that were focused on education. The reality is, in a high quality service, whatever its label, if the educators are appropriately trained and the service is fulfilling its mission, it will provide learning and development opportunities for children. Actually, I love the word thrive. I love that word in the Thrive by 5 campaign. And I think we should embrace it because it's such a joyous word. It's kind of a much happier word than outcomes, for example. I don't think outcomes are really important, but I also want children to thrive. So I think children can thrive in a setting, whatever its label. And if the setting is appropriately organised and the hours are relevant to the needs of the community, that service can also facilitate and underpin workforce participation by parents. So I think, just to speak from my own personal perspective, there has been, we have heard a lot about early childhood education and care as only being about supporting workforce participation. I think we're hearing a different message now, and I really welcome that. So that's what I would say about that issue.
Thank you. And while you're on a roll, Deb, a question about the engagement, how people can engage with the inquiry, and specifically the engagement with Aboriginal and Torres Strait Islander people. There has been a question about whether there's a co-convener from representative of the Aboriginal and Torres Strait Islander community, and your approach to engaging with First Peoples. Okay,
thank you for those questions. Well, I'll take them in the reverse order. I'm fairly new to the Productivity Commission, but one thing I've learned is that the Commission is really ramping up the ways in which it engages with First Nations communities in each of its inquiries. While we don't have an Aboriginal or Torres Strait Islander co-convener, we do have an Aboriginal commissioner who takes part in many deliberations around our inquiries. We've also engaged with SNAIC twice so far, and we have some more meetings with SNAIC coming up. In fact, I think our meeting with Catherine Little was one of the very first, Catherine was one of the first people that the three commissioners met with, and we've met with her again. And we've met with her again in the context of the National Policy Partnership for Early Child Development for Aboriginal and Torres Strait Islander children. We have regular engagement with that body and therefore with Catherine. We're about to travel up to Darwin, and where we'll be visiting a number of Aboriginal and Torres Strait Islander organisations and services, and we'll probably be going to Alice Springs as well for a meeting of the National Partnership. So we're giving that we're taking that issue very seriously and giving it a major focus in our inquiry. In terms of how people can engage with the Productivity Commission, firstly, let me say we are really keen to have individuals and organisations engage with us. At the moment, there's a call for submissions, which probably many people involved in an organisation will be aware of. And that first round of submissions we'd like to see coming in by the middle of May. I think it's 19th of May is the date on the website. We know, however, that there's a lot going on in the sector and that many people are preparing submissions for other inquiries. So we're certainly not saying that we're saying get your submission in. We'd love it to be as close to that time as possible. If that's not possible, it'd be great if you could let us know, because we'd like to know what's coming down the track. Submissions often sound like they would have to be great, lengthy, complex documents. They don't. They can be simple, they can be short, they can be something that was prepared perhaps for another recent inquiry or in response to a query from government. Pop a covering letter on it, send it to us. The Commission website also has a space for comments, and that is as simple as typing your comment in. It's simple if you have access to a computer. But we're really encouraging that, and you can also see the other comments and submissions that have come in. We're required to put out a draft report by the end of November. We'll certainly be doing that. And then there'll be another round of submissions in response to our draft recommendations and public hearings again around the country. And then our final report is due to government on the 30th of June next year. So those are the major ways people could engage with the inquiry.
Great, thank you. Thanks, Deb. Jay, I might come to you. A question from Nicole in the chat has been about what are some of the best examples that exist, whether it's in Australia or around the world, of where this has been done brilliantly. And I know Thrive by Five have been looking around the world for systems that really do click and sing. Do you want to give any examples from your perspective of where you've seen it really shine?
Yeah, so at a big level and then at a sort of very local level. So at the big level, there is a fascinating little case study in Canada where they went for a pretty simple system of $10 a day for every family, or $5 a day. Actually, it's now getting towards 10. And it's interesting, a number of other jurisdictions went for a much more targeted system to try and support disadvantaged families. And the irony was that the jurisdiction that went for that universal approach got more disadvantaged families into it than the one that sought to actually target disadvantaged families. And there's an interesting message there about simplicity. If you've got a system that's easy to navigate and you know what's going on, that can be a very powerful incentive to participate. And we saw that during COVID when they switched the system off and all the barriers disappeared and the cost disappeared. I know that Snake certainly reported there was a whole bunch of new families that wandered into the Aboriginal specific services they hadn't seen before. So we can't underestimate the disincentives that complex systems bring. So that's the big systemic question. At the local level, and this is very local, like in Western Australia, one of Midriff and Thrive by Five supported a local school called Chalice School in Armidale in West Australia. And the principal there was really struggling with the looking at some pretty ordinary NAPLAN results, but she was seeing all these women coming in with their children at age 5 with all these babies on their hips. And she was thinking, you know, why am I waiting 5 years? I want to get at those kids, you know, so that we've got a chance of actually affecting their trajectory. So she, contrary to all the rules, set up a 0 to 5 service, essentially to engage mothers and those babies, and tried to coordinate all the other bits and pieces, infant maternal health. And that had a really powerful effect on learning outcomes for those children. So I'm a big fan of actually, you know, these birth to sort of end of school sort of models, like the Doveton School in Victoria is a powerful model, which I know they're rolling out now. But a lot of those, and we tried to do some of them in South Australia in our children's centres, but the bits that was missing was that we could do what we could do in the state service systems, but it was always difficult to get the Commonwealth service systems engaged because they were a separate level of government, and they were running a different model. That the sort of school-based system had a different, you know, mechanism and funding model to the Commonwealth system. So somehow trying to find a model where all those things could actually participate in the one place would be great.
Yeah. Just on systems and services that might be counterproductive. I mean, recently there's been reports from a number of advisory committees to the government about the Parents Next program, and particularly the activity test. And you've mentioned that, you know, during COVID, some of these things were suspended and resulted in, you know, some terrific outcomes and participation. Wondering if you and Gretchen want to say something about the activity test and whether you think it should be part of the system going forward or not.
Well, Gretchen, kick off, and now I'm happy to supplement.
And Gretchen, while you're coming in, it was good to see Myra Geddes in the chat saying how inspiring she found your remarks.
Yeah, thanks, Myra. Look, in terms of SNAIC's position on the activity test, is, you know, obviously is, you know, been quite vocal in relation to the decreasing or even the abolition of it. So I guess one of the things that's really interesting to think about is that we talk about affordability and we talk about childcare, and, you know, the focus is very much upon, I guess, you know, workforce participation and so on and so on. But, you know, when I'm out in community, I often hear about the need for parents to have some kind of, I guess, acknowledgement or reciprocity around how much their children are nurtured, how much their children are cherished. So I think in terms of outcomes, it's when, Deb, you talk about being excited about the word thrive, I get excited about parents actually having that, I guess, desire to see those kinds of outcomes for kids, that they're actually cherished in community. So I'll hand over to Jade to talk more about the activity test.
Yeah, thanks, Gretchen. And just on that, I mean, I always remind, I should put a plug in for my role as, you know, ambassador for Reggio Emilia, the founding father, as it were, of that system. Laurence Malaguzzi had a phrase which always resonated with me, which was nothing without joy. And I think that's the, you know, that's the overall framework. We're talking about, you know, a beautiful part of life. The first 5 years are miraculous, and watching children be the best they can be is just an endless sort of source of joy. And when they're deeply engaged in their play, that's what it looks like. And if we're creating spaces for that, is what we really need to do. Of course, the other thing about workforce participation is that it's not entirely an economic proposition. It actually can be quite, there's a wellbeing element of that for parents as well. And of course, it sustains family incomes, which has its own effect on well-being. So there is a little bit of a virtuous circle here about these things. But it's not, it seems to me it's not an end in itself. We always need to be coming back to the question about the child in the context of all these systems. But the activity test is a peculiar one because it sort of presupposes that to get access to childcare, you need to, or early learning, you need to actually pass a test, the parents need to pass a test. So a child's entitlement to get what they need, that is early learning, is conditional upon what the parent does or doesn't do, which itself is a curious proposition, given that we don't ask that of schools. Schools, you know, we don't ask school children what their parents are up to let them in the school gate. So that's the first thing about it. The second thing that it misunderstands is that to actually get a job, you actually need already to have your childcare organised, because there is a significant cost of searching, and that's what Angela Jackson's report sort of revealed, that the cost of search is a massive barrier to entry into the workforce. And so you've got to have childcare sorted out before you actually even start the process of looking for a job, because it's not a simple matter to actually find childcare. So that she actually estimated that there's about 126,000 children that are missing out on access to early learning opportunities if we were actually get rid of the activity test. And that's a powerful number. It's likely that those are the children that would most benefit from early learning opportunities as well.
Yeah, thank you, Joe. And it was a recommendation of that Economic Inclusion Committee that it be abolished. Deb, might be time for one more question, and it's from Dr. William Bohr from the University of Queensland, who's very supportive of the aims and the goals of what's been discussed this afternoon. His question is about the evidence base for the first 5 years compared to other important life phases and transitions, adolescence, older Australians. And he would like your comment on the quality of the evidence base in the period that you're looking at.
That's a really good question. I think the issue, I think there's a very strong evidence base for the kinds of interventions in the early years that we've been discussing this afternoon. As you mentioned at the beginning, a few years ago, Susan Pascoe and I produced a report called Lifting Our Game, which was specifically directed at the question of preschool education for children in the 2 years before school, and we reviewed that evidence and published that in a report that I think has been pretty widely accepted, certainly by governments and by the community. I think there are really interesting issues when we come to discuss the issue of 0 to 5 provision on a universal basis. I think the sort of evidence we're looking for there is of a range of types. It's not simply the randomised control trial evidence that shows that a specific dose of this yields a certain number of points in that plan, because we're talking here about families, children, and communities. So we're talking about what this actually means what it actually means in the lives of children and families to have access to a safe, welcoming space where they can, for example, connect early in life with potentially an early intervention service or an educator who will pick up on a developmental delay. I think there's a lot we could do to strengthen the evidence base in Australia, but I believe we have sufficient to go forward with confidence.
Thank you, Deb. And look, we're almost out of time. And so what I want to do first is just give a very quick plug for an event coming up that Snake and Thrive by 5 are involved in, which is about improving access to early childhood education and care for Aboriginal and Torres Strait Islander families and children. And I just want to close by thanking our brilliant panellists. We haven't been able to get to every question, but I think we've given a solid coverage of the issues. We've heard from all of you about the enormous opportunity that's in front of our country to really land an early childhood development system that works wherever you are in Australia, regardless of circumstance, and can help to prevent and alleviate poverty, given how dramatic the numbers are, which were shown at the beginning of this session, and how important a better universal platform will be to boosting inclusion, equity, and reducing poverty and disadvantage right around this country. It was powerful to hear about Jay, the importance of that one quality, powerful message, and Gretchen, the wonderful examples you gave of the 65,000 years of history and the work that Snake is doing in community, particularly through the Connected Beginnings approach. And Deb, how wonderful that there's so many different ways that people that are joining this conversation can engage in Australia's early childhood system and the way that it should be over the coming decade. I think submissions for the early years strategy closed today. There's the ACCC inquiry, the Productivity Commission inquiry, and because you did mention lifting the game, some enormous ambitious reforms at the state and local level as well. And I think the challenge and the opportunity, as Jay put it, is how we join those up in a way that is simple and makes sense, and especially makes sense for those children and families that have been missing out on these services for too long. So with that, thank you everyone for joining us for this BSL talk session, and thanks especially to Jay Weatherall, Gretchen Young, and Professor Deborah Brennan. We'll see you next time.
Thanks, Trav.
Thank you, Jay.
Thanks,
Thanks.
Trav. Thanks,
Thanks,
Jay. Thanks, Deb.
Great job, Gretchen.
Oh, thank
Yeah.
you.
Really.
Look,
Yeah.
I could talk the leg off a chair, let's be honest. So sorry I went over time, Trav.
No, it's fine. I saw.
No, it's all good.
Yeah,
It's all
good.
valuable.
Yeah.
You can be the clone for Catherine now. We'll have to start rolling you out, Gretchen.
Yeah.
Oh, God
We
forbid.
can find you too.
All right. Thank you very much, everyone. Have a
Thanks,
great
everyone.
Friday.
Thank you.
Bye.
We'll
Bye-bye.
make sure we package up the recording and get the captions on it and send that around and promote it when that's available. But thanks again. Looking forward to continuing the conversation.